all things that we feel are just passengers on our bus, that's in our head, right? It's okay to have all of these things that we travel with, depression, anger, anxiety, frustration, joy, peace, all these things travel with us, but you don't want the negative emotions driving your bus.
We face our problems every day. It seems they'll never fade away. The world may bring us down. Tonight we're gonna turn it around. So let's put it all on the table. Talk about it if you're willing and able. Life's having insecurities and a laugh or two. Come and take a seat. So bring your concerns to us. Together we can discuss what's on your mind. No matter what you go through, just know we'll be here for you every time. Let's talk about it. Blind table talk. Let's talk about it. Blind table talk. We gotta be about it. Go ahead and walk the walk. So let's talk about it. Blind table talk. Let's talk about it.
What's going on? What's going on? Welcome to Blind Table Talk. I am your host, Fleeks, security of the community. Hey, welcome back to the episode, y'all.
Yes, y'all. Welcome back. So excited to have you all here again this week. I am Sassy Sy, your blind butterfly.
Most beautiful one. Yes, indeed. Y'all already know.
Thank you.
Hey, we really appreciate y'all sitting down with us and joining us for the episode. As this being our May is Mental Health Awareness Month, we just wanted to really make a special episode for you guys.
Because one of the things, and I think mental health, it's so under discussed, right? It's so
Sure.
it's like a taboo. Nobody wants to talk about it. Everybody, it's like
people kind
something's
of
wrong.
afraid of it type of thing.
Exactly.
Shameful, type,
It's-
and we really shouldn't be. So we shed some
Yes.
light to it.
Yes, exactly. So, of course, we do have a great episode for you guys, but let's go ahead and just remind you again of our website, www.blindtabletalk.com. Also, on this episode and any episodes, or even if you just want to say, hey, please feel free to give us a call, leave us a voicemail, or send a text to 800-321-6456.
Yes, indeed. And also, do not forget about our YouTube channel. That's Blind Table Talk. You can find all our interviews on there. You can like, comment, subscribe, and share. Please feel free to do so. You can catch all of our
Yes.
interviews on there and the security booth. And also, don't forget about our sassy seat. You might have something you want to
Yes.
talk about, the little sassy seat, right?
Yes, and I do. Speaking of Sassy Seed, last week, if you guys have not checked it out, please. I did an episode with me and my daughters,
Such a beautiful episode.
and it was, it was just the reason why it was so special for me, because I've never actually asked my children, any of them, even my son, nobody, what they really thought about me or growing up with a blind mom or the experience how it affected them. I've never asked them that. So really, really eye-opening and fun at the same time. But, as we discussed, I think that more parents should do that. More moms should do that. Dads should do it. So we have decided to do a, special episode of Blind Table Talk with the parent and the children, and asking, those questions of what your children really think about their blind parents or being a child of a blind parent. So please, if you would like to be on that episode, email us at info@blindtabletalk.com. We would love to have you at the table. All right, well then let's go ahead. And are you ready to jump right into the episode? Because we can go ahead and get started. We have some great guests, some ladies here that are going to be talking about mental health.
Yes, indeed. Yes,
tips,
indeed.
Suggestions,
Definitely excited for y'all to witness this.
Yeah. And, sometimes we need help to identify when we need help. So
yeah, we get to share a little bit of tips. You're going to hear some of our testimonies and whatnot. So, hey,
Yes.
sit back, kick back, go ahead and pull on up and let's get to it, y'all.
Blind table talk, yeah.
Alrighty, we have a special episode for you guys tonight. tonight we're doing something a little bit different here. We're going to be combining two of our segments that we truly enjoy. Tonight we're going to be having our roundtable mixed with here our community segment seat. So please welcome to the table. Enjoy the episode. Sassy, what we got for them?
Yes, well, thank you. And I am so happy to be doing this little dual episode. I think it's in honor May is Mental Health Awareness
Yes,
Month.
indeed. Yes,
And
indeed.
so we, thought it would be good to kind of introduce some good therapists and counselors and things like that, as well as talk about some mental health issues
Definitely
that are
important
in the
topic to talk about, right?
it is, it
Yes.
is. So, but also want to make sure we have who else we have at the table with us, and we have our podcast administrator, Miss Christina Ford.
Hello,
Welcome.
everybody.
Yes,
Hey,
hi
boss
there.
lady, thank you for having us.
Yes, yes. And then and so then the two lovely guests we have for the night are Debbie and Dawn, and I would like for them to each introduce themselves. And they're just wonderful, awesome, beautiful, spirited women, and I just would love to welcome them to the table. Thank you both so much for joining us.
Happy to be here.
Thank you, Saida. Very sweet. Okay, so my name is Debi Herrera. I've been, oh gosh, part of the BPN, Blind Professionals Network community for,
Mhm.
a few years now. So that's how I know Saida. And I actually am about a year possibly away from retiring from the state of Texas. So I started to pursue my LPC, which is stands for Licensed Professional Counselor credential, once I knew that I was going to be retiring from my full-time career. So doing that so far has been a passion of mine. And before that, I did work as a counselor, but more of a case manager counselor with an independent living community and a blind and visually impaired community. So I think all that kind of set me up for wanting to do this as I go into the next phase of my life. So in that, I have been so blessed to have met so many wonderful people, including Dawn. The blind and visually impaired community, it's a very tight, specific, unique community. And you've met one person and you realize that you know somebody else, and oh yes, I know her, even though we all live in different states and different cities, because it's a very small, unique community. But in addition to that, I'm also a registered nurse. And so I do diabetes education also on the side. There's always a little bit of counseling involved in that. Some of you might be familiar with diabetes distress, and that is a very true, real thing. People do feel anxiety and depression over having diabetes and managing diabetes. So I've been doing that for several years now as well. So anyway, we'll get more into all that later, but I wanted to
Yes.
go ahead and hand it over to Miss Dawn.
Well, yes, thank you, Debbie.
Thank you,
That was
Debbie,
that
for
was that
joining
was
us for
yes,
sure.
that
Yes,
was a
indeed.
lot. I love it. Thank you. All right, Miss Dawn, you are up.
All right. Hello, my name is Dawn Scott. I am also an LPC associate, dropping the associate hopefully by fall. I am visually impaired myself, but I spent most of my adult life as a military spouse and a good portion of it not living in the US. So I didn't have access to all of the wonderful groups that y'all have. But now I'm here in San Antonio. So
Yes, exactly.
I have done some work with Lighthouse for the Blind, which is now Vibrant Works, before I finished my master's and my licensure. I have been married for 31 years. We have 5 children. And
Congratulations on
thank
that.
you.
That's
Yes,
very,
indeed.
So,
that's not
Awesome.
common. So
Yes,
yes,
yeah, we're a
indeed.
big family. So a lot of my experience is life experience.
31 years and 5 kids. I'm
And
sure there's
5
a lot.
kids,
There is a
It,
yes.
I
lot,
like
lot
that.
crazy. Yeah.
Beautiful
Yeah,
stories there for sure. I have to believe.
Well, thank you so much, Don.
Yes,
Welcome to the
indeed.
table.
Welcome, welcome. Thank you for joining us for sure.
I cannot stress enough how important mental health is. So, can you give us just a general overview for now, just about what you guys actually do in your services, and then we'll dive deeper into the other stuff, and then all of that good stuff. So,
Dawn and I have well, we both do have private practices.
Mhm.
However, we are here today to kind of let everybody know of a partnership that we currently have, specifically for people who are blind or visually impaired. Not to say that we would not work with other individuals. We do have experience in working with other individuals, in particular with disabilities, but this partnership was formed so that we could focus on people with blindness and vision loss. The partnership is actually called Focus on Hope Counseling, and it is with another provider. Her name is Dr. Judith Cepeda, spelled with a C, Cepeda. And Dawn actually is the one that has worked with Dr. Cepeda before. So when just a little background on why we formed this partnership, both Dawn and I, while we are LPC associates, we are not able to bill insurance. And I had been approached, or we had both been approached about, whether or not we could see people with like Medicare or Medicaid or other insurances, which the question is a good question. The answer was no, not yet. But there are some ways that we can see people. So Medicare in particular, we're able to see people who have Medicare under Dr. Judith Cepeda and her credential, provider number, etc. So I will go ahead and see if Dawn, did you want to mention anything about Dr. Judith as far as like her experience in working with people, the elderly population, or
Yeah, she's a psychologist, licensed psychologist. She's been mostly working with the elderly for I think at least over a decade. I don't know for honest.
Mhm.
It's been a minute.
Mm.
She employs LPC associates to work in her practice. That's how I met her because I worked for her for a year. But yeah, she's lovely, and she's going to be doing our billing for us, hopefully.
Yes.
Yes.
Awesome. Awesome.
And that's a very big service in and of itself. That's the part we don't want to do. So
Right.
so
Yeah.
I mentioned Medicare, but that doesn't mean
Mm.
that we won't see people without insurance. So the flyer, it does kind of mention that we can see people. It will know which way to route that person, whether they have insurance or not. So if somebody does have Medicare, we will be able to probably see them. But if they don't, then we also do what's called pro bono, which means we can see people, just at a very low cost or no cost. We also can see people in what's called private pay. And sometimes that means somebody maybe has insurance, but they don't want to utilize their insurance for different reasons. Sometimes we can even offer, what they would normally have paid for a copay, as a private pay. But all that would be discussed with whoever, wants to call and just find out. We could find resources for people. Even if we're not that resource, we could definitely find resources for someone who's looking for somebody to talk to, therapy or counseling. As far
Yeah.
as the kind of population, again, we kind of focus on the blind and visually impaired. Like Dawn said, she has a visual impairment. I myself do as well. Mine kind of started in my adulthood. So I was, I'm going to say 30 when my visual impairment started. So I've kind of, gone from, still driving with a little bit of a vision loss at age 30 to my nice now ripe old age of 55. And now using a cane. So I've kind of, had that journey. I can still see a little bit. I'm just sharing a little bit about that. I can still see. I do still have some vision, but I do use assistive technology. So I kind
Right.
of know what people go through, what people have gone through. And I think that is one of the reasons when people started reaching out to Dawn and I about whether or not we were seeing people, it was because people who were experiencing blindness or vision loss, uh, I believe, felt more comfortable talking to somebody who maybe had experienced what they had experienced or were experiencing. Because I think there's a different level of empathy that somebody who's gone through something can provide to someone who's going through.
We talked about this in previous shows, Joseph, if you remember. And
Yeah.
and I've said that I would prefer to have a therapist that, is visually impaired just for that relatability, and they actually will know what I'm going through. But the disclaimer was that I still believe that a sighted counselor is still, effective. I just would prefer, visually impaired. So I don't want people to think that if they're blind, they cannot see a sighted
Absolutely.
Right,
counselor.
Right.
because like my
Right.
my alternative from that is I'm currently in therapy, and my therapist is sighted.
Yeah,
And it's a different way of going through it, because like you said, a lot of things that I talk about with her, I still have to kind of,
explain.
explain a little
Yeah,
more. And I
yeah,
mean, but luckily she's been kind of around, so she has some awareness, and and
yeah,
it for me is like, okay, I don't mind having to really go that extra step to kind of have her just understand where I'm coming from. But I can definitely see where it's definitely more beneficial to have a therapist that can really, once you say your situation, they actually get it from that relatability point for sure.
yeah,
And it's not necessarily like a requirement or a prerequisite. It doesn't mean that somebody who's sighted is not going to be an
yeah.
excellent therapist. I was in therapy, gosh, back in 2018 to about 2020. And my counselor therapist was sighted, and she's amazing. I had sought
Hmm.
out Christian counseling, and she's fabulous. We
Yeah,
still know each other, and I think the world of her. And she's an excellent therapist. So it just depends on what your needs are. It just depends on what
right.
your needs are.
Yeah,
And finding
For
that
sure.
perfect fit, finding
yeah,
that fit. So, and that might be somebody who's blind or visually impaired, and that might be somebody who's not.
Yeah.
yeah,
So
yeah.
I wanted to know, like, is there a difference between counseling and therapy? Like you said, based off of your needs. So, like, is there a actual difference in the two titles?
that's a good question. I think they're kind of just used interchangeably many times. Dawn, what would
Yeah,
you
it's like
interject? I would.
there.
Mhm.
It means the same thing.
Mhm.
Yeah. Oh, okay. Well, there you go. It means the same thing. And yeah, I
I
would have
think
thought it was different, but
I think if somebody were to ever say there was a difference, sometimes therapists as opposed to a counselor. So a counselor, you'll notice that you see the word counselor used a lot in a lot of different fields. So like, like you go to a weight loss clinic and they have weight loss counselor, or you'll go
mm-hmm.
to somewhere else and they'll call somebody a counselor. So maybe a counselor does have some sort of school or education or whatever. Therapists generally, I believe, have a little bit more specific training, specific education to provide therapy, which is then something that you need to be licensed for.
So we would like to know, like, what are some common misconceptions that you run into dealing with the mental health, and how do you guys, go on by and explaining that with others?
I think people, when they envision therapy, they envision like the Freudian therapy where you lay on the couch and you talk about your dreams and dream analysis and your childhood trauma. And some
Yeah,
people do that.
yeah.
It's okay to discuss those things. But I think the majority of people that attend therapy are really seeking somebody to be beside them, walk beside them through their difficulties and give them guidance. And kind of help them see we carry our own answers. Honestly, we carry our own
Hmm.
answers. Most of us have the skills, we just don't have access to them at this moment. And counseling and therapy, that is really what it's meant to be for, is to give the client be there for the client while they access those things. And
I,
but I
you
mean,
know,
it's not Freudian. You're not laying on the couch with your eye, with your eyes closed.
Yeah.
I love that you brought that up because, like, honestly, I was one of those ones before I attended counseling and therapy, I was like, okay, man, I'm about to really gonna have to lay on these people couch and just kind of be vulnerable with myself.
Mm-hmm.
And that's the type of thought process. 'Cause, I mean, you see these things on sitcoms and movies, and so
Right.
that and kind of like what you said with the Freudian, you learn to lay on the couch, but that's not how it goes. You're
Yeah.
sitting down and just learning how to have more guidance and deal with more structure for for the situation that you're dealing with.
Yeah.
Right.
What do you guys think about? Because another misconception that I think is out there too is like when they think mental health, they think something's wrong with you. You're crazy. Something,
Really,
you
yeah, I
know.
was thinking about that when I read your question. Just to be clear for anyone listening, the DSM-5 Diagnostic Statistic Manual is for diagnosing. The purposes of that is to diagnose for insurance purposes. That's the main use of it. So when somebody is struggling with symptoms of anxiety or symptoms of depression, and we'll get into that later,
Mhm.
it doesn't mean that's who you are. It means that's what
Right.
you're struggling with something. And
Right.
diagnosing is not to put you in a box. It is just to literally bill insurance and also give counselors guidelines on what symptoms we're trying to improve upon. So it's not, I don't want people to feel like, going to a therapist, they're going to be called something, a
Right.
depressed person
Or labeled.
yeah,
Yes.
labeled.
Yeah.
Exactly.
Well, yeah.
It's
Yeah.
as my personal approach with all my clients. I don't like labeling. I don't think it's helpful. I think acknowledging symptoms is helpful, but depression is not who you are, and neither is anxiety or PTSD. That's the symptoms you're having.
And there are times when people actually choose not to go through insurance because they don't want to be diagnosed, and they choose
Mm.
to just private pay actually. So, and then there's different reasons for that. One of the other, I think, misconceptions I think that I've seen out there is that if you go and look for or seek out counseling or therapy, that it's going to fix
Mm.
whatever it is
Mhm.
you're looking, your issue or whatever it is you're seeking therapy for.
Mhm.
Mhm.
So that's not necessarily what will always happen. I mean, the therapist is there primarily to kind of help you, like Don mentioned earlier, go through and learn new skills and have new tools that you can use to help you. Like she said, you already have the answers. So we're
Yeah.
really just there not to tell you what to do, not to advise you what to do, but to help you understand what you already know, what you already know,
Yeah.
Yep.
and just, kind of help you go through that process.
I mean, that is a key point that should be emphasized is
For
that,
sure.
we're not getting fixed because we have to work on ourselves in multiple ways, right? And our mental health is something that we need to continuously work on, I feel, and I can't just go to you and say, here, my appointment's at 3, at 4 o'clock when I'm done, I should be cured.
Healed and fixed. No,
Yeah,
it's
healed and
homework
yeah.
you must do amongst yourself, and
Yeah.
it's a
Yeah.
steady process. And I thank you for that clarification, Ms. Debbie. I'm glad that you said that because our
Yeah.
Sure.
listeners
Or
need to
like
hear that.
somebody might say, "Oh, well, how many sessions before you think I'm
Be
I'm
done. Yeah,
cured?"
I don't
Right.
know. You
No.
can't answer that. Yeah. All right. Well, okay. So, speaking of, just wanted to see if we can go over if you guys can share with us just some things that we can recognize that should tell us, wait a minute, we might need to, red flag. We might need to think about this. Something could be wrong here. So what are you guys' thoughts on that?
So with depression and symptoms specifically, I think that's what most people really worry about. Well, anxiety, like if you have panic
Mhm.
disorder.
Yes, but
Does go hand in
yes.
hand.
Yes.
In depression symptoms, if any of your symptoms are keeping you from enjoying your normal life, your regular life, then it's a problem
Mm,
that you should likely seek help for. It could be you're not getting out of bed in the morning. You're just struggling to, connect with your family and friends. Maybe you're disconnecting with your social
hmm
group. You're not taking care of yourself. It could be physical symptoms: not showering, not combing your hair, not brushing your teeth, not eating properly, struggle getting
Insomnia.
to work. Yeah,
Hmm.
yeah. So your sleep. people often when they have depression have trouble sleeping. They either sleep too much or they don't sleep enough, and that's usually the first symptom is sleep.
Yeah.
And some of the weirder symptoms that you might see in a loved one that some people don't really talk about would be like irritability or negativity. So maybe somebody who has in the past been a fairly positive person and really social, and then over time they've really developed this negative attitude. They're irritable, they're cranky, they snap at you. There's likely something going on deeper. And then the same with anxiety. Anxiety can come out as irritability as well. Because you don't feel right. You're over maybe sensory overload and those kinds of things just makes you irritable. So that's just something to know when you see it in other people. Also, a lot of people don't talk about it out loud, so you may not know, but suicidal ideation, which is thinking about suicide, not necessarily having a plan, but just thinking about wishing I was dead. I wish I could just not wake up tomorrow. The world would be better off without me. Those kinds of thoughts, suicidal ideation. And if you're starting to have those kinds of thoughts often, then it would be probably helpful to seek counseling or therapy. Suicidal, if the person has a plan, that's different. That is how they're going to do it. They have the means to do it. They don't have protective factors like family and friends, a good social support. Then they probably need help more immediate. So just that's something to be aware of.
In the beginning, okay, so in the beginning of what you just said, I get it. Is there a time frame? Because, I know there's sadness, right? I'm sad and then I'm depressed. But some of the stuff, you guys, honestly, that you've mentioned, I mean, I do that sometimes. Like I don't want to get out the bed. I don't want to get up.
Everybody deals with depression, and that's one of the misconceptions. I think that's why I don't like labels, because I think we all go through that, and sometimes it's hormonal and sometimes it's how we're eating and situational, we're treating ourselves. Sometimes grief causes depression, and that's real. You can't just snap your fingers and be done with it, right? Sometimes it's environmental. If something happens, maybe your house burns down, or you lose a loved one, or your children leave home and go off to college. There's all kinds of things that can cause us to go through a period of time. So I think if that period of time, and I don't like to put labels of time on things.
A time frame, right? You're like, okay, in 3 months you should be bitter. You're not over it.
It's impacting your job. It's impacting your family and your social network and all of that. If it goes on for months and you're not being able to move through it, you don't feel like you're making movement, it doesn't hurt to talk to somebody.
Not at all. Not at all. Even if you just call and talk to a friend. But there actually is, in our field, it's called a PHQ-9. It's 9 questions. So basically what it goes over, it just asks, it's a self-assessment. You ask yourself these 9 questions, over the past 2 weeks, again, not putting, a time frame on it, but over the past 2 weeks, how often have I felt sad? And I believe the choices are not at all, several days, half of the days, every day, things like that. So I think that one, and again, anybody can look that up on your phone, online. If you just look for, depression self-assessment, something like that, it'll pop up. But again, it's if you're starting to notice it, and like Dawn said, if it's affecting your life, but like you said, it's normal, to have a little sadness, just feel a little melancholy once in a while, and it's situational. So, but if you start to notice that you're experiencing it more times than not, then definitely, even if you don't talk to a therapist, talk to a loved one, talk to a friend. My best friend, we used to, we still joke about sending each other a bill because because we're each other's therapists, it's like that's what we are to each other. So
it is. And, because I do want to share, like, depression is real. Right. I, and even just recently, I had a weekend where I did not contact, I was down. But I think one of the keys to it for me is knowing how to get back up,
Mhm.
right?
Yeah.
And how to fight my way through that. And that sometimes can be done on your own, but I still even like track myself. Okay, this is day 2. Like, what are you doing here? Are you able to pop out of this, or do you need to call somebody? And I still think we should be aware of, if we are able, because sometimes, and God forbid, maybe the time could come that I'm not able to bounce out of that. And some people may not. And I think that is where we need to be able to be honest with ourselves and reach out for some help.
Truthfully so.
And
Yeah.
I'd like to just really quick, since we're kind of like on that subject and we talked
Hmm.
about suicide and ideations and a plan, there is a number, like if somebody doesn't have somebody to talk with or they don't want to, 988 is the phone number. It's a number that it's just like 911. So if you're
Oh, you just
experiencing,
called 9. Oh, I didn't know
yes.
that.
So if you're experiencing a medical emergency, you would call
Hmm.
911. But if
Right.
you're experiencing a mental health crisis, even if
Hmm.
it's the fact that you're so depressed and you're thinking about harming yourself, 988.
And also too, I would like to, I want to find that, the 9 questions. You said that's online, right?
It is. It's called a PHQ-9. Don, correct me if
Mhm.
I'm wrong. I think it stands for Patient Health Questionnaire 9 for 9 questions.
Yeah.
Awesome.
Yeah.
You're
Yeah.
taking me back to my school days, so I
There's
PHQ9.
don't.
also one anxiety called the GAD-7.
Yes.
The
Hmm.
Gab 7. Okay.
Oh, okay. Can we touch on that for a second too? Because I always, and I don't know if I'm using or saying it the right way, but I always say, "Oh my God, that's giving me anxiety," or "I have anxiety." But
Mhm.
what really is anxiety? What exactly is that? I mean,
Well,
is there?
the physical symptoms would be like your heart racing, you feel
Mm,
sweaty, maybe a little bit
mm,
shortness of breath, maybe a little out of body experience feeling,
mm,
that loopy feeling. Some people actually get to where they have chest pains, their
Hmm.
racing,
Or
wow.
shortness of
yeah,
breath.
yeah, and
Hmm.
shortness of breath. And if they're having like panic symptoms, you can also get racing thoughts of that feeling of impending doom,
Hmm.
Mm,
and intrusive thoughts. Often those will be like, something bad's going to happen,
yeah.
and
Yeah.
it's hard to control it. Um,
Mm,
Most of us have anxiety. It's to some degree at all,
Hmm.
right?
right. Yeah.
So social anxiety is when this happens in social situations, right? Where
Hmm.
you're kind of nervous and uncomfortable in social situations.
Right.
Regular anxiety is when you worry about those situations. So that's kind
Mm.
of the difference.
Yeah, right. So when you're just
Okay.
around a lot of
About
people,
it,
because I
yeah.
know like social anxiety around a lot of people, you're like, oh my God, this
Yeah.
is too
Right,
much
right,
for me. This is too
right.
much. Right. Yeah.
Hmm.
And along
Hmm.
that same topic, I mean, they say there's no such thing as a dumb question. So I'm just gonna phrase the question like this. Do you think the depression and anxiety does that trigger different for us who are visually impaired compared to the sighted community?
So I live with sighted people who have dealt with mental health issues. Sorry,
Hmm.
people trying to call out my people, but
Yeah.
and I know people, and then I, obviously know some, blind VI that deal with that. I
Hmm.
don't think so. I don't know that it's something that we consciously do. Does that make sense? So I don't know that we
Mm,
consciously
Hmm.
control how our symptoms manifest. I think
Right.
most of us get a little irritable. Most of us get down. Maybe we avoid social interaction because we just don't want to be around people and have to explain ourselves to them.
mm-hmm.
So I think it's similar. I think what triggers it might be different for blind VI because
Yes.
of the things that they deal with, especially vision
Hmm.
loss. And so I was born with my issues, my vision issues. They did get worse at a point when I had a retina detachment. I don't know, like 5, 10 years ago, but a little bit worse, but not by a lot. So
Mm-hmm.
I don't have the experience of having really good vision and driving and having all these freedoms and then having that taken away.
Hmm.
So I've had to figure out my freedoms from the very beginning. So I have my whole life to figure it out. So people that lose vision, I think there's a lot of grief involved with that,
Mm,
A lot.
and a lot of self-esteem issues. Um,
mm,
your purpose.
And a lot of anxiety,
Yes.
and depression. So I agree with Dawn. I don't think the symptoms would be different, but
Hmm.
what triggers them would be,
The
is
difference.
what to look for. So,
Mm.
and I think Saida and I were talking about this yesterday. I mean, even something as simple as, knowing your environment, feeling comfortable in your environment, and then knowing that you're going to have to travel somewhere,
Hmm.
having to learn a new environment, not, depending on the level of your vision, that
Hmm.
could be very anxiety inducing. Now, some
Hmm.
people have that anxiety already, even if they're sighted, but
Yeah.
some people not sighted or very, very, visually impaired would have that anxiety
Yeah.
about, gosh,
Yeah.
I've got to go to this hotel room. Okay, so how am I going to get to the hotel room? Okay, so once I get there, where's the bathroom? Where's the bed? Where's,
Yeah.
all these other like things that people have to worry about and think about ahead of time can cause quite a bit of anxiety, especially if that's just not something that's normal for them. So
Yeah. Absolutely.
traveling for work versus traveling with family.
Is
So
Hmm.
different.
traveling
Yeah.
with your family because you're going on vacation, you've got all your family there. Traveling for
Hmm.
work, maybe not so much.
Right.
You're
Yeah.
expected to be there and be independent and do what you need to do. So
Yeah.
not to say that blind and visually impaired aren't completely independent, but
Right.
it definitely can cause some anxiety. So
Well, I know anxiety is real, and now that we're talking about it, like I look back and I mean, I can recall times that I've actually had anxiety attacks, and Debbie, that was
mhm,
actually one of them when I was in the airport by myself, which I do it
mhm,
all the time, and I call myself a pro at it, but I lost my cane.
uh-huh,
Oh my
And
gosh.
yeah, exactly. And so, I mean, so when you guys were saying my heart was racing, I
mhm.
mean, it was, and so I had to breathe. I mean, so those things, as a blind person, I don't think that, somebody sighted, their, their triggers would be different. They wouldn't do that for losing a cane if you
No,
have
that
sight.
dude that losing their car
Right.
keys.
Yeah. Yeah, exactly.
Yeah.
That
Yeah.
that's interesting because working in the field of blind and visually impaired population most of my life, I'm around a lot of O&M instructors, orientation and mobility instructors that teach people how to use canes.
Mm-hmm.
By the way, guys, don't call them sticks.
I know,
Anyway,
right?
Right.
so the first thing that they would say if they heard that you lost your cane, why did you lose it? Why wasn't it with you the entire time? That's
Yeah.
I'm like, because I had to
Yeah.
set it down.
Yeah. Well, what happened with me is I got out the Uber and I was, getting all my crap that I had, and then somebody
Mm-hmm.
that worked there came and assisted me. And so I just, I took his arm and did sighted
Right.
guide and just, just completely left it. And so the Uber
Yep.
took off with my cane.
Yep.
So, yeah, but I usually it is with me, but stuff like that, especially when you're running late and you're doing this
Yes.
and,
And
it
that
can,
could change everything. I mean, that could change. So
yeah,
now you don't have a cane. And so
yeah,
now what's the rest of your day going to look
right.
like?
The whole,
So that
yeah,
person was, yeah.
yeah,
So
yeah,
it is.
And it's
right.
funny that we talk about this because so right now I'm currently traveling for my adaptive sports, and so we have a volunteer who I'm sorry to call her out, I love you, but so we're traveling and whatnot, and she's using the GPS to navigate, and the phone dies. And
Oh,
Mm,
and immediately like I hear her breath like just start quickening, and
uh-huh.
we're like, what's wrong?
mm-hmm,
She's like, the phone is dead. I don't know this point. I don't
mm-hmm.
know what we're really gonna do. And we was like, okay, you the only side that wasn't here. Let's pull to the side, and I
Yeah,
could see like, her
that
kind
could be
of
her
right,
anxiety.
exactly.
She
So
Mhm.
caused anxiety.
you,
Yeah.
you know, and so that's what made me trigger the question that I asked. Is there the difference or is it the difference in the trigger? And so I really appreciate you ladies for the clarification on
But
that.
and I know, you know what though, Joseph, imagine how she felt being the only one that was able to help you guys, with the only sighted one there, and then now I can't help them, and now what are we gonna do? I can just imagine. I feel that's sad. I feel
Yeah, and the
anxiety
sad
for
part
her.
because all of our phones were low, so I mean,
Yeah.
eventually we pulled to the side, but it was like
Yeah.
it was a
Yeah.
situation.
So
So now probably Dawn and I want to just jump in there and just talk about breathing exercises because
Yeah.
you said she was breathing really fast. It's like, okay. And I think that was one of the things that you had asked
Well,
on.
that's what, yeah,
Yeah,
that's my, actually, that was our,
good
we
segue.
could jump right into
Right.
there.
Very
Some,
good
yeah,
segue.
so just maybe some tips and, immediate in the moment things that we can do to help ease, and not just anxiety, but depression as well. I mean, what are some things that we can do on our own before we get to the level of having to seek out therapy or a counselor?
Depression. So if you're having a hard, like we all go through stuff, right? And if you're
Yeah.
going through stuff, try to keep in mind self-care. With my clients, we talk about the bare minimum. So
Mm-hmm.
there's going to be days, especially if you're dealing with very serious, like grief and things like that, or something, situation that's been very difficult. There's going to be days you don't want to get out of bed. There's going to be days you don't want to talk to friends. And so we talk about our bare minimums. And sometimes I'll even make a plan with them of what their minimums are going to be. And that may be just all you do that day is you have to get up, you have to get a shower, brush your teeth, comb your hair. You have to eat at least one good meal, one nutritious, feed your body with nutrition, and try to step outside. And if that's all you do that day and the whole day, you're going to be better off than just staying in bed. So, and you're going to just feel better. You're going to feel a little better about yourself too.
Right. Yeah.
It's okay to be sad. I tell my clients that all things that we feel are just passengers on our bus, that's in our head, right? It's okay to have all of these things that we travel with, depression, anger, anxiety, frustration, joy, peace, all these things travel with us, but you don't want the negative emotions driving your bus. So you don't want those things making the choices for you. So it's okay to acknowledge them. I say it out loud. And I think that's actually healthy when you wake up, especially if you're having a day where you're just feeling out of sorts and you're just feeling kind of sad. Maybe you're missing a loved one that's passed away. You can say, wow, grief, I see you're my passenger today. We got things to do today.
Yeah.
You can go with me for a little while, but you're going to have to get off soon.
Yeah.
I likes that. I likes that.
But it's okay to say it out loud and say it to others. I'm kind of having an off day, and maybe do something for yourself that brings you to a different place, a better place. So that's what I got for depression. And do not cut off your relationships. I say depression's a big liar. Okay. So whatever depression is wanting you to do the opposite for real. Depression is wanting you to stay in bed. No, it's going to make things worse. Depression is wanting you not to text your mom back because you're going to feel better that you did.
Yeah, Don, can some of it be with that though? I just want to because when you don't want to talk to other people, sometimes it's just that I don't want to bring that energy and bring
To
other people
them,
down.
And you can say,
Yeah.
that's when you can say to somebody, I'm having a really off day. I love you. I'll try to connect tomorrow. So they know that you're okay. I think people get worried when you drop off the face of the earth. And especially women, we're very intuitive. So with our friends and our moms and our sisters and all that, right? Our brothers, dad, we're like, why haven't they texted back? They're usually about it, and we get concerned. So, you really want people to kind of back off for you for a day or two. Say, what? I need some time to myself. I'm really sorry. It's nothing personal. I'm just having a weird weekend. I just need to recenter myself.
Got it. Yeah.
Excellent communication. And actually, that's, what you're saying about wanting to just not have that conversation, like you say, oh, I just don't feel like talking to that person right now. You're just setting a boundary, which is also one of the most common things that we talk about in therapy as well is boundaries. A lot of people feel bad, like they know that if they don't reach out to, like you said, your mom or your sister or your best friend or whatever, you're going to feel bad for not doing so, but you're just trying to take care of yourself. And so eventually that's one of the things that we help people get through is, being able to set that boundary in a nice, kind, tactful, generous way so that people don't feel bad about it, but you're just trying to take care of yourself.
Yeah.
But
Yes,
you
indeed.
have to be careful because one of the first signs of major depression is isolation. So that's why
Mhm.
Mm.
I say it's okay to step away for a couple of days, but if you see it becoming a trend, there's likely something deeper going on that you need to address because
Mhm.
that's what depression does. It takes you literally away from anything that brings you joy.
Mm. Yeah.
Okay.
Yeah. Does breathing really work?
Yes.
Yes.
I was going to just
Absolutely.
I have to say yes as a massage therapist. I'm sorry. Yeah,
Oh,
yes,
massage
yes,
therapist.
indeed. Yes,
If
indeed.
You guys think
474.
so? It
yes,
It
does.
Yeah.
does. There's
yes.
a 757 that I
Yeah.
like to
Yeah.
utilize, which is, I mean, if you feel yourself, starting to, have that uncontrolled breathing, and you're just starting to, and I actually had somebody in my office just a few weeks ago that, I couldn't even get through that many, question or, discussion without eventually the breathing just was just so rapid. So we would just stop, just stop. And so then I would just kind of help her and direct her to say, okay, let's just breathe in through your nose. Count seven, right? So 1, 2, 3, and just help, count
Mhm.
to seven as you're breathing in through your nose, and then breathe out. Hold it for 5 seconds, and then breathe it out. Just breathe it out through your mouth for seven counts. So, and you just do that until you've slowed your heart rate down and you've slowed your breathing down. And yes, I've seen it work. It does work. So,
Mm.
Dawn, how about you? What's your experience with that as
So
well?
breathing is great. I especially if you're just in a moment where you're getting
Mm-hmm.
really anxious. If you get past that point, okay, because some people get past the point where they're starting to
Mm-hmm.
feel that panic.
Mm-hmm.
Mhm.
You
Mhm.
can also ground yourself by things you see around you. If you're visually impaired, maybe not so easy.
Mm-hmm.
5 things that you see, maybe 3 things that you hear. Like just
Mhm.
Mm-hmm. Mm-hmm.
Or like focus on them?
yes, focus on it. Like, what do I hear?
Mhm.
What do I smell?
Mm-hmm.
What do I
Mhm.
feel? Maybe the ground feels warm under your feet. Maybe you're walking in sand or grass. Maybe it's the cool breeze. Focus on your other senses, right?
Mhm.
To kind of
Mhm.
center yourself in and ground yourself in the now, in the moment, because that's where you
Mhm.
want to be.
Mhm.
If it gets really to where you're just feeling just out of it, like it's off the charts, cold, exposure to cold. So if you have something in the freezer, like a bag of peas, for example, right?
Mhm.
If you sit with your feet on the floor and you put the bag of peas, cold, the frozen peas in your hand, and you lean forward and place your face in that bag for a few seconds, that will take you out of a panic
Yeah,
attack.
nice little shock to your system. Mm-hmm.
Also,
Mm-hmm.
placing it on the back of your neck works as
Mhm.
well. Vigorous exercise. I always tell people you can't be in a panic attack if you're doing push-ups.
Mm.
Yeah,
Mm.
yeah,
Mhm.
because you're engaging the rest of your body, and that's where your focus goes. Your brain has to change focus. Um,
Mm.
in place, something like that. That does help for some people as well. So yeah, there's different techniques depending on what you're dealing with.
And then so
Awesome.
utilizing
Love
all
the
your
answers.
senses, like even taste.
Mm-hmm.
So if you
Hmm.
have something that you can, well, I mean, if you have a little slice of lemon or something that can taste,
Right.
like she
Mm.
said, the
Hmm.
senses. So using all your senses. So if you were going to use taste, something like lemon, something like salt, something that would
Mhm.
just take like she said, your mind away from the anxiety.
Right.
So.
I have a client that deals with panic disorder, and she will
Mm-hmm.
actually take a cold shower sometimes because it just takes her right out of it. She can't
Mm.
focus on anything else but the cold.
That makes sense. I
Yeah.
mean,
Yes,
yeah,
indeed.
definitely some great tips.
Love the
I think,
clarification. Yes.
yeah, I think that we can all, take advantage. And you know what? Not only that, what if, maybe somebody does not struggle with panic or depression but the anxiety, you will
Mhm.
know how to handle it for your loved one that might be going through an anxiety attack.
Mm-hmm.
So,
Yes.
grab the peas out the freezer, just, do that,
Mm-hmm.
Take the
so
breath, the
But even
yeah, those
757,
breaths.
Actually,
Hey.
Yeah.
Any pulse point would be
Yes,
good. So like,
yes.
Dawn did mention like on the face, on the back of the neck, on your wrists, where people old fashioned would take your pulse. So any pulse point, you'll feel that.
Thank you, ladies, for sharing such,
Beautiful information. Yes,
yes,
indeed.
yes, great information. And then I want to, give the opportunity for you guys to, tell our listeners how to contact you and how to reach out. But before I do that, we'd like to ask for each of you if you would like to give some last words for our listeners that may be,
Yes, indeed.
facing this, or your thoughts on Mental Health Awareness Month, and or just
A
anything
little
that you would
tidbit
like
for
to.
them.
Yes,
Yeah.
exactly.
Thank you so much for having us. We really do appreciate it. I guess for me, final thoughts would be, just reach out, whether you're reaching out to a therapist or to a family member or a loved one, talk to somebody. Reaching out for counseling or therapy isn't saying that you can't, that it does not make you any less of a person. I know a lot of people that, think, oh no, I can get through this on my own, on my own, on my own.
Mhm.
And sometimes you just need a little help, and that's okay. And that's really what it's for, so that we can just help you guide, get you through that. Because like Dawn said earlier, you already have the answers. We're just there to help you. Um, the Focus on Hope partnership, there is a main number. The main number is 210-999-1800. Isn't that like a perfect number?
Yeah.
That is a really good number
We were
for
so
sure.
blessed to have gotten that number. It's crazy. So that would be for that particular partnership, and we can get you connected with, we'll probably you'll have an initial maybe 10, 15, 20-minute call with Dawn or myself. And then from there, we'll get you over to Dr. Cepeda. And then we'll figure out everything else after that, like insurance or just different ways. So, and then as far as contact information, my business name is called ANC, Seeds of Hope Counseling and Wellness. The reason I named my business that is because mustard seeds. I don't know if biblically, if you have faith the
Yeah.
size of a
Yes,
seed.
indeed.
So
Hmm.
that's why I have that in mind. But
Yes,
so
ma'am.
seeds of hope, because we should all have hope, and sometimes we don't, but that's what
We definitely
we'd be
should.
there to help
Yeah.
with. Counseling and wellness. So and it would be that same number, that 210 number. But and Miss Dawn?
Yes. Thank
Yes,
you,
Miss Dawn.
Debbie.
Thank you, Debbie, for
Sure,
sure.
certainly.
Yes,
Well,
ma'am, Miss Dawn.
thank you so much for having me. I have really enjoyed this. So, for Mental Health Awareness Month, I just want everybody to keep in mind that self care is your number one
Mhm.
defense against deteriorating mental health. I think everybody should have a feel good playlist. Everybody should have
Oh, yes,
Yes,
candles.
indeed.
absolutely.
Yes, candles or activities, favorite TV shows,
Yes, indeed.
favorite places you go walking, favorite friends that you have that you can connect with when you're having a hard time. If you struggle with remembering these things when you're having a hard time, make a list or a little thing on your phone, a little note on your phone, things to try when I'm having a hard day. Because sometimes when you're in it, you don't think about these things. And my this helped my teenagers a lot when they were young.
Mhm.
Um, so there's that. Just take care of yourself, and it's okay to take care of yourself, and it's okay to have a bad day or a bad few days. It's okay to talk about it. And in 2025, the landscape of the world has changed a good bit to where there's not so much stigma anymore on mental
Mhm.
health. Um,
Yes.
so people are a lot more accepting than they used to be. So it's
Mhm.
okay to say it out loud, y'all, and you'll feel better just not living in a vacuum. Uh,
Yes.
Very
don't
well
isolate
said.
yourself. Come on now.
Right,
Hmm.
right.
Yes.
Yes,
We have
Yes.
indeed.
friends for a reason.
Yes.
So my practice name is Dawn of Hope. Ah, clever, right?
Love it. Love
That is cute. I
it.
It's
love it.
beautiful.
Yes, indeed.
So you can reach me by the phone number that Debbie gave through our partnership. I also have a separate number which is 210-560-1217 for my private practice. But the partnership, you would end up seeing either of us.
Thank you, ladies.
Thank
for
you
sure.
both
you.
so
Yes,
much.
indeed.
Thank you. We appreciate you guys joining us at the table.
Blind table talking.
Oh my gosh, you guys. I hope that you guys got some stuff. This was a great show, don't you think? Like,
Man, blessings indeed. Like, they shared so many good tips on how to really deal with the different anxiety and depression, and I mean,
Right.
such beautiful ladies, and you could tell the passion that they have to want to just
Yeah.
help us out here. So man,
Yep. But you know what? The funny part is, because
Yeah.
we got such deep into the conversation
into
that
it.
we did not get to mention the types of counseling and therapy and services that they provide. You know what? I think I'm actually just going to go ahead and read the flyer for you guys for the counseling services that are offered. That way we can make sure you guys have a clear understanding of what is available for you. So we have Focus on Hope Counseling Partnership, counseling for a new normal, vision loss, disability, and other medical challenges. We are skilled, compassionate, blind, and visually impaired therapists who feel the daily struggles of living with physical and emotional challenges. We provide individual, couples, and family therapy for those facing the difficulties of life's many obstacles. Whether you have Medicare, another insurance plan, or no coverage at all, we're here to offer care at a cost you can afford. Areas of care: disability, grief and loss, depression, anxiety and stress, marriage, parenting, veteran support, and major transitions. And then the clinical staff that oversees these services is Dr. Judith Cepeda, Debi Herrera, and Don Scott. So there it is. Listeners, please feel free to reach out to them. We will also include the phone number and email in the description of this episode.
Until next time, y'all. Be blessed.
Blind table talking.